and I'm co-chair of Brampton and Caledon Health Coalition. We're here outside of Brampton Civic Hospital, and we're announcing our protest this coming Monday from 3 to 7 p.m. We have some leaflets if you would like to distribute them, and we also have social media posts that you can amplify. And we're also talking about this report from the Ontario Health Coalition that came out today, that I have printed right here in front of me, and it is called, excuse me one moment, Illegal, Unlawful, and Unethical Case Studies of Patients Charged for Medical Care in Ontario's Private Clinics. So, this study has uncovered several patients who have been charged for medical services contrary to the Canada Health Act. The Canada Health Act from 1984 at the national level and Ontario's Commitment to the Future of Medicare Act from 2004 provide legal protections for Ontario residents to receive needed healthcare services without financial barriers. The foundational principle of Canadian public Medicare is that all Canadians have equal access to the medical care we need without being charged user fees or subjected to extra billing. With no mandate, and in fact leading into the 2022 election having sworn to the public that they would not privatize, in January 2023, the Ford government announced plans to expand for-profit clinics to do surgeries and a range of diagnostics that are currently provided in public hospitals. Concerns were raised about the well-documented history of for-profit clinics violating the core tenets of public Medicare by extra billing and charging user fees to patients illegally, among other problems associated with this privatization plan. In response, Premier Doug Ford promised no Ontarian will ever have to pay with a credit card. They will pay with their OHIP card. But this is just not true. When the Ford government used their majority to pass enabling legislation, the euphemistically titled Your Health Act, to privatize those services, the government promised guardrails to ensure staff would not be poached from public hospitals and patients would not be turned away if they choose to pay with their OHIP card. In fact, they removed the guardrails. Predictably, and despite the Premier's headline-grabbing rhetoric, user charges for access to needed health care have proliferated. The Ontario Health Coalition has received complaints from hundreds of patients who have been charged for care in private clinics. In February and March of 2024, we received surveys from 120 patients who have experienced one or more incidents of user fees, extra billing, or manipulative upselling, and conducted more in-depth case studies of 18 patients who have been subjected to extra charges at private clinics that are unlawful, unethical, and or illegal. This report includes the evidence from these case studies. The Ford government plans to expand the cataract surgeries that they're currently allowing people to privatize into hips and knees and other surgeries and diagnostics. The vast majority of the complaints that we received are about for-profit cataract surgery clinics. The Ford government's privatization of our public health services and the concomitant rise of user fees charged for patients by the for-profit clinics and hospitals pose an existential threat to the future of our public healthcare system that has taken our communities a century to build. The Ford government is doing substantially nothing to stop the now rampant out-of-pocket charges that the private clinics are charging patients. The evidence shows that for-profit cataract surgery clinics are frequent violators of the Canada Health Act and the Commitment to the Future of Medicare Act. Yet the Ford government has increased their funding by a whopping 300% and is giving massive expansions to companies that are in breach of our Medicare laws, while claiming to the public that they will never pay with their credit card, only their OHIP card. The Ford government is actually doing the opposite. They are allowing unfettered user fees in the thousands of dollars for the often elderly patients in need of surgeries and tests. Charging patients for access to these healthcare services reestablishes the two-tier healthcare system that Medicare was designed to end in 1966. It must be stopped. We've been building these public hospitals for 100 years, and they're being dismantled right now. So these are our key findings from the report. We had 18 in-depth case studies of patients for cataract surgeries. 5 patients were threatened with longer wait times if they chose not to pay out of pocket. 3 patients had vital information about their procedure withheld, which didn't allow them to make an informed decision. 12 patients were manipulated or coerced into paying out of pocket for unnecessary add-ons. And 6 patients were told there was no free option or were never informed that they could get the surgery without charge. We had 231 patient surveys. And of the 231 patients, 121 reported one incident or more of extra billing, user fees, or manipulative upselling. 82 of these are about cataract surgery, 16 are about primary care, 15 are about physician-ordered laboratory tests, and 3 are about diagnostic. We also have responses concerning endoscopy, colonoscopy, ophthalmology, hernia surgery, vasectomy, and OHIP-eligible fertility treatment. And 3 patients reported violations of more than one service. So we had more than one of these things happen to a few people. And we have more information about what is covered under public Medicare, what are the most common violations of public Medicare laws in Ontario's private clinics. We have more information on the case studies and more in this report that you can find online at ontariohealthcoalition.ca. And you can also go to our website, bramptoncaledonhc.ca, to find it. About our patient that we have in Brampton, I will be reading their statement. This statement is from a Brampton business owner. I'm a small business owner in Brampton, Ontario, and I'm also the primary caregiver for my retired mother. In 2023, both myself and my mother required bilateral cataract surgery. Our optometrist provided a referral to a private eye clinic in Mississauga and informed us that cataract surgeries covered by OHIP would only cover the most basic lenses and that wait times were considerable. Due to my only rapidly deteriorating vision, I was anxious to proceed with surgery. My mother was advised that there was a possibility of her driver's license being revoked due to deterioration of her vision. We both attended consultations at the same clinic and were given quotes. There was no verbal mention of OHIP-funded surgery during the consultation. Our decisions to proceed with surgeries were motivated by what we were led to believe to be A, substandard OHIP-covered lens implants, B, very long wait times compounded by a massive backlog due to COVID-19 interruptions and delays. My total invoice was in excess of $6,000 and my mother's almost identical. The clinic consultant recommended we opt for the laser incision as opposed to the standard scalpel incision for an additional $2,000 fee. When we questioned as to the necessity or benefit of opting out of the laser incision, the consultant admitted there was no data to support any better outcome or discernible difference in the healing process. We declined this outrageous upsell. Given the obvious impact of the COVID-19 pandemic on small businesses and my mother being a retired senior citizen on a fixed income, the nearly $15,000 cost of the combined surgeries has been a horrendous financial burden to our family. Upon learning that the wait times for this vital surgery were greatly exaggerated, it is undeniable that both myself and my mother could have avoided this substantial expense. Had there been more transparent communication from the referring optometrist and the private clinic about the perfectly adequate OHIP-funded options available to us, we never would have elected to give our hard-earned money to an opportunistic private clinic. Publicly funded healthcare is being jeopardized by our provincial government pouring money into private clinics. The predatory practices in these clinics must be stopped to protect Ontarians. So we would like to thank the patient who came forward with this statement. And we also have another statement from somebody who is phoning in. I just have to grab the phone call. So we have a phone call submission to our press conference today, and I'm just going to call her. Hi, this is Janine from Brampton Caledon Health Coalition. Is this Rosa?
Yes.
Hi, I'm calling about your story of being billed for healthcare.
Oh, yes.
Okay, we're just on we're doing a live broadcast right now, and we are going to be...
The sign's about to blow off there. Okay.
So we're going to be telling people about your story. Are you able to speak now about what happened?
Sure.
Okay. So what happened when you went to a private clinic?
I had the first day, and she told me what to do. That I could go to the hospital, but she didn't know who was going to do the operation, if it was her or different people, but she didn't tell me the price.
Okay.
With her, at her clinic, private clinic, it would be $8,000.
$8,000. That's a lot of money.
Yes, but I have to pay as soon as I get my cataract done. And I had to pay on the 30th, that's when I had it done.
Wow.
Otherwise, she would do it.
So, I have a statement from you that is written out. I'm just going to... Oh, actually, I don't think I can actually find that. But do you have the written statement that you provided us? Or would you like to tell in your own words?
Yes, I do.
Great.
So, April 30th.
I'm just going to go where I can... there's a lot of traffic noise. So I'm just going to go where it's a little more sheltered. Can you read your statement for us?
Say that again?
Can you read your statement for us?
Yeah, I have it here. Hold on.
Okay.
I have it right in front of me and I can find it. Yes.
We have a patient right now who's reading her statement about getting billed by private clinics.
Yes. Okay. Actually, she didn't say on the statement that I had to pay the same day. She only wrote it down and she told me in the
Okay. That's okay. Let's just go over the facts then. So you were charged $8,000 for your cataract surgery. How did they tell you about the cost? Did they mention OHIP covered services at all?
No, she didn't mention unless I don't remember that she mentioned anything.
Yeah. So did you have someone else there with you who
No, I was alone.
You were alone? Okay.
Yeah.
And so was that for just the basic surgery, or did they ask you to get add-ons?
No, it wasn't a basic surgery.
Mm-hmm.
My left eye, I had astigmatism.
Yeah.
She says she'll fix that. And the other one, I had, what they call it? Anyway, my right eye, the because I wasn't ready, and I told her because the doctor told me, and she says, no, we can do it just the same. But I felt a lot of pressure, and to nowadays I'm still having problems. I went twice to the clinic, and they told me there's nothing wrong with my eyes. I'm fine.
Yeah.
I just have to cope with it.
But you felt pressure to get surgery and get it for thousands of dollars.
Yes.
And get things that weren't covered by OHIP.
No, it wasn't covered by OHIP.
Yeah. Well, thank you for telling your story today. Go ahead. Do you have anything else to add?
Sorry.
Hello?
Yes.
Do you have anything else to add to your story?
Not really. I've read her little thing, 9 things that she should know about the surgery. I read that, and it seems to be fine. But at the end, I still have to wear my sunglasses inside the door. But when I'm inside, because it's too bright.
So your vision still is bad, even though you got this very expensive surgery. You still have to wear sunglasses inside the house.
Yes.
That's horrible. I'm so sorry.
But the doctor itself, the one that operated, she doesn't check me. Everybody else did, and they keep telling me it's fine.
Yeah, so your doctor said that your vision was fine, but the private clinic sold you a bunch of things?
Yeah, the clinic kept saying it's fine. Your eyes are fine. Everything is okay. There's no problem.
Okay, but you're still feeling effects?
Yeah, especially
Okay.
my left eye.
Okay.
My left eye yes, my left eye.
Yeah. So, are you feeling a financial burden from spending all of that money?
Yes.
Yeah, $8,000 is a lot of money. That could buy a lot of expenses.
All my CPP, old age security, and everything.
Yeah. That, especially when you're on a fixed income like many seniors are, that's a lot of money to have to pay out of pocket, especially if you aren't planning for it, because a lot of people planned to have OHIP take care of them in their elder years.
That's right.
Yeah. Well, thank you for having a call with us today. I hope you have a great day.
You too.
Take care.
You.
Do you mind filming again? Here. You can just film me and I'll handle this. Okay. So,
Reverse. There we go.
okay. Hi, everyone. So, we just heard from 2 patients that were sold services that were not covered by OHIP, and they were not told that there were services covered by OHIP. We had $6,000 for 2 people. Actually, this is 3 patients because 2 of those patients are from the same household. So we had a household with 2 bills that were $6,000. We had a patient who was spending, I think it was $8,000 on a fixed income. And we have even more in this report from patients who are telling these stories that are horrible and illegal according to the Canada Health Act. You cannot ask people to pay for OHIP covered services. You cannot upsell them medically unnecessary tests, surgeries, fees. And we're finding there's a lot of trickiness going on in these private clinics where they are getting some of our most vulnerable citizens who, if you are lucky enough to get old enough, you will probably get cataracts, and people are on a fixed income. That's a very vulnerable position to be in for a lot of people. So they're taking advantage of our elders who are often living in poverty, and it's just not okay. So you can read this report on our website, so ontariohealthcoalition.ca or Brampton and Caledon HC.ca. And you can also learn about our healthcare protest. That's going to be this Monday, the April the 22nd from 3 to 7 p.m. So we are trying to stop healthcare privatization like we have been speaking about. We want more hospitals for Brampton and Caledon because we do not have enough. And we want OHIP for all, regardless of their immigration status. And on our website and in this flyer, you can see some of the facts about privatization, about OHIP for all, and about Brampton and Caledon hospital care. So we have privatized care where people are being charged 3 to 4 times the cost of OHIP, what OHIP is normally billed, for cataract surgery, 3 to 4 times the OHIP cost for MRIs, for hip surgeries, and even 10 times the cost of OHIP for shoulder surgeries. And we have a helpful diagram about where your money is going when you pay both through your taxes and from your wallet for these surgeries. And a lot of it is just going to people who already have a lot of money, the investors and owners of these private clinics. We also have information on OHIP for all, regardless of status. So approximately 500,000 people in Ontario do not have access to health insurance. Those who are uninsured include those with temporary residency status, those awaiting immigration decisions, new immigrants in the first 3 months of their arrival, and undocumented people. And many healthcare workers are not insured by OHIP despite holding up our healthcare system. So when somebody who is taking care of our family members, of us, of our community members, gets cancer or is injured, or is even injured in the workplace doing very hard work, often for these private companies, we are abandoning them and allowing people to get sick, and much sicker than they should be, and even die from preventable disease, from things that can be treated. We had a solution to this, which was the Physician and Hospital Services for Uninsured Persons program, called PHUP or FUP, and it provided needed medical care to the uninsured during the pandemic. It was very successful. It saved Ontario money. Patients didn't wait until their problem required a hospital visit. They got the care that they needed. And we recognized the need for this during the pandemic because people being sick affected everyone else. But now we're isolating these people to deal with their healthcare problems by themselves when it does affect everybody, especially because the lack of healthcare causes financial, practical, and emotional distress, and it puts a lot of pressure on our already overtaxed hospitals, including this hospital right here, Brampton Civic Hospital. So, Brampton Civic Hospital is the lone full-service hospital in Brampton and Caledon. It covers both. We have one hospital that's full service with 645 beds for 827,500 people. We have a chart here that shows how many hospitals we need. So the blue is what we have. To align with Ontario hospital ratios, we would need 2 more hospitals, 3 hospitals in total. To align with the Canadian ratios outside of Ontario for hospital beds to citizens or residents that live here, we would need 4 hospitals in total. To align with international or OECD ratios, that's a group of countries that are usually very developed internationally, we would need 5 more hospitals. So 6 hospitals in total where we have 1. This is just unacceptable. And if you ask about Peel Memorial, I have a little half of a hospital here because we, so we have Peel Memorial, but even with the expansion, it's not a full-service hospital. There's only going to be 250 beds being added, which won't be available to patients in emergencies. There's no trauma unit, there's no ICU, there's no maternity ward, and no surgical operatories. Both of these hospitals are P3 public-private partnerships that are not owned by Ontario, and the non-medical services provided are provided by private companies with contracts. So when you have things like food, parking, maintenance, repairing electricity, cleaning, all of these things not being provided and supervised by the government, you get a lot of corners cut. And all of these things affect our medical care. So we have privatization already taking hold in Brampton, and it has for a long time. Brampton Civic Hospital was actually the first P3 hospital, and we have shown that it cost a lot of Bramptonians. We have hallway health care. We have a second hospital that never turned into a real hospital because of cost overruns. And we have information about all of this, and we have this handout on our website. So if you would like to join us on Monday, this coming Monday, April 22nd, from 3 to 7 p.m., we would love if you would join us and talk to us about your story on healthcare. So we're going to be holding signs like this one right here, if you can show it, Aaron. Signs like this. We have our banner. We want you to bring your flags and your signs from your unions and your community groups. So we really want people to show up in force and tell our Ontario government and all of our governments, local, provincial, and federal, that we need more. Brampton and Caledon deserve more, and that's our tagline for this protest. We need more health care. We need better paid staff. We need actually putting people into beds and not treating them in hallways. We need health care for all, regardless of OHIP status, because there are a large number of people in Brampton who do not have access to OHIP, and it is unacceptable for people to be going to our hospital with problems that could have been solved if they had primary care. And that is happening across the board, whether somebody has OHIP or not, but especially if they are uninsured. So with this report on privatization and the information that we have on our website and on our flyers, we really feel that we have a great case for Brampton and Caledon getting more health care and better health care and public health care. So please join us this Monday, 3 to 7 p.m. You can sign up on our website, bramptoncaledonhc.ca. You can follow us on social media and subscribe to post notifications to amplify if you can't make it. And you can sign up to volunteer, and volunteering you can do in small ways or in big ways. You can just forward our emails, just share our posts and comment on them. You can send us a testimonial. You can show up to the protest, or you can help us organize. There are a million ways to help, and we need everybody if we are going to get better health care. Thank you so much. Have a great week, and I hope to see you on Monday.
Thank you.